Well, it's that season again.
Ragweed season is coming, and I'm going to go through all the different nasal sprays you need to know about that are over the counter so you don't have to look like that guy when ragweed starts. Hi, I'm Dr. Imam. I'm a board-certified allergy doctor and obesity doctor, so if you want to learn more about weight loss or allergies, click to learn more or follow. So there's a bunch of over-the-counter nasal sprays that a person can use. So I'm going to start going through them one by one, but in general, this is what I'm looking for. I'm looking for a spray that's effective. I want it to have a poor bioavailability, meaning I don't want it to get absorbed systemically. I want it to stay just in the nose. And I don't want it to be addictive or have a rebound effect. This is Nasacort, and its steroid is called triamcinolone. Now for all of these, you can use the generic or the brand name. Now triamcinolone is an older generation. It works really well, but it does have a higher bioavailability, so there are better options out there. Some people report that this is less irritating in terms of causing nosebleeds. I haven't found that for the most part. I would pass on this one. This is Nasonex, so this is mometasone, and this is recently approved over the counter. This might be a little bit more pricey, but it has a poor bioavailability, which is actually good because we don't want it to get absorbed systemically. So this one is okay. I would use this one. This is Flonase or fluticasone propionate, and this one is pretty effective, poor bioavailability, which is good in this case. So this one's also a good one to have. This one or the generic, and this is a cheaper one. So this is probably the best bang for its buck, especially if you get it from Mark Cuban's pharmacy or GoodRx or Sam's Club or Costco. This is a really cheap one, and you might need it for 2 months during ragweed season. Budesonide, also known as Rhinocort, effective but higher bioavailability, so really no need to use this one unless your ENT or your allergist recommend it for nasal washes because of allergic fungal sinusitis. Oxymetolazone, also known as Afrin. Multiple brands have something similar, but if you see oxymetolazone, this one is addictive. The rest of them are not. So this one will cause rebound. So this one we do not recommend unless you're using it for less than 3 days during maybe an acute virus or you're about to get on a flight, but otherwise this one's a no-go. Another Flonase, well, I don't get it, 2 fluticazones, but this is fluticasone fluorinate. This one actually works better. It binds to the receptors better in the mucosa. So this one does work better than the other one, but it's more expensive. So maybe using the other one twice a day or just the other one for the price. If it works, you don't have to use this one. Astepro or Azolastine. This is not a steroid nasal spray. This is an antihistamine nasal spray. So it's like a Benadryl for your nose. This one can dry you out a little bit more, and it does taste bad. But the good thing about this one, it can be used in conjunction with Flonase. So sometimes an allergist will put this one and Flonase together in order to give a person better relief. This one also works a little bit faster. The Flonase and the other steroid nasal sprays usually work within 6 hours, and they work better multiple days in a row. But this one's good for a quick getting runny nose to slow down in about 15-20 minutes. Nasachrome, this one's available over the counter. Usually you have to order this one online. This one works pretty fast. It does have a drying out effect. It doesn't really get absorbed systemically, so it's pretty safe, even safe in younger kids. However, it has to be used more frequently, so it's not commonly used. We might use it more commonly in like pregnant females who are having rhinitis of pregnancy, for example. If the nasal sprays don't work or you need something more on top of them, over-the-counter antihistamines are not a bad idea. However, keep in mind that if you have allergies that bad, there is a specialty called allergy that can do allergy shots or allergy drops to desensitize the person so they don't really have to suffer this much and be this debilitated during the allergy season. All right, hope that helps.